and I am the recorder. Okay, go ahead, Kara. Okay, Kara. Come in.
Hi, my name's Kara. I'll be your student nurse from UDM. Close the door here for privacy. If you don't mind, I'll wash my hands before we get started. Okay. And can I have your name, please? Full name?
Katie Heinen,
All right. Date of birth?
9/26/88.
Okay. And then are there any allergies we should know about?
No.
Okay. And do you know what date it is today?
October 2nd, 2013.
And do you know where we are?
UDM.
And do you know why you're here?
School.
Okay. Patient is AO times 4 to self, date, place, and situation. Are you in any pain right now?
I'm not.
Okay. Patient appears stated age. Patient appears to be in good overall health. No obvious signs of illness. No body odors or odors from the mouth. Patient has appropriate posture, appropriate mood and affect, clear speech, and is overall calm. I'm going to go ahead and move into the assessment of the scalp here, which we're going to palpate and inspect for any lesions, bumps, masses, or malignant melanoma, any parasites or lice, and assess the hair here, which appears to be healthy, not brittle, so patient appears to be well nourished. No signs of alopecia or balding. I'm going to go ahead and move to the face now. Go ahead and close your eyes for me. And let me know when you can feel my fingers touching your face.
Yep.
Okay. Assessing cranial nerve 5. Go ahead and open your eyes. You can smile for me. Puff your cheeks. Blink each eye. Okay, great. Assessing cranial nerve 7, all within normal limits. Then we're going to go ahead and move to the eyes here. I'm just going to pull down your eyelids here to inspect your conjunctiva, which are pink and moist, no signs of edema, swelling, redness. Go ahead and move into the eyes, which are both symmetrically placed, equal, and pupils are equal and round. And also, go ahead and just look straight for me. Be assessing each eye for reactive to light, and then again keep your head straight. Just watch my pen for me, and appropriate accommodation there, which is cranial nerve 3. Going down, nose is midline, appropriately placed. Then we're going to move to the mouth, assessing the lips first. No signs of cold sores. Lips are pink and moist. No signs of cyanosis. Can you open your mouth for me? Say ah. Stick your tongue out. Great. Uvula is midline. Tonsils are a +1 grade. Buccal mucosa is pink and moist. No signs of plaquing, lesions. Tongue is pink and moist, as well as, open one more time, and as well as the gums and are pink and moist. Teeth are all present. No signs of dental appliances. And that sums up the mouth there. And we're going to go ahead and move into the neck here, where we're going to palpate for the carotid pulse. And on each side here. And carotid pulse is present bilaterally, a 2+ grade. Now we're going to go ahead and oscillate each of those locations with the bell. Okay. Sounds clear, no signs of bruise, which present as a whooshing sound. We're going to go ahead and palpate the lymph nodes here. Let me know if there's any pain with palpation here. The preauricular, posterior auricular, occipital, jugulodigastric, submandibular, submental, superficial cervical, deep cervical chain, and posterior cervical, and the supraclavicular. Okay, any pain with any of that?
Mm-mm.
Okay, great. I'm going to go ahead and move down to the arms here, which we're going to assess temperature, which is warm to touch, colors appropriate for ethnicity, palpating for any lesions or bumps, also noting any edema by pushing against any of the bones in the arm, which none is noted. Can you go ahead and squeeze my fingers for me? Okay, bilateral strength, good strength, strong. And then we're going to move into the fingers here, which we're going to note for any clubbing and normal capillary refill, less than 2 seconds. And then also, over here, we're going to palpate the radial pulses bilaterally. And then up to the brachial pulses, which are both present bilaterally in a 2+ grade. And then I'm going to go move into the back here, which I'm going to start by let me know if you feel any tenderness with this, assessing the CBA. Any tenderness?
No.
Okay. And then we're going to move right into the posterior lung sounds here. We're going to oscillate in 10 places, so every time that you feel my bell touch your back, you can take a deep breath in out your mouth there. So we would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we would do laterally there. Okay, and also on this angle, assessing the AP diameter, which is normal 2 to 1. Moving into the anterior lung sounds here. Again in 10 places. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And lungs sound clear, no adventitious sounds noted. Then we're going to move to the heart sounds, where we'll start with the aortic area, second intercostal space. Pulmonic, also second intercostal space, where S2 is heard loudest here. Down to herbs at the third intercostal space. Tricuspid at the fifth intercostal space. Mitral apical, where we would hear S1 the loudest. Also, we'd stay here for 60 seconds with the diaphragm. Turn over to the bell, and stay for 60 seconds, moving back to tricuspid, herbs, pulmonic, and aortic. Heart sounds normal, no sounds of murmurs or whooshing. Any valve problems noted. Can you go ahead and lay back for me here? Okay, now we're going to begin our assessment of the abdomen here, where I'm going to note that it is flat, no signs of distension. Also noting that there are no signs of scars or lesions or bruising, maybe from past surgeries. Then here we would start by oscillating the right lower quadrant. We wouldn't stay here longer than 5 minutes, noting for bowel sounds. Then we move in a clockwise motion up to the right upper quadrant, left upper, and left lower quadrants. So bowel sounds present. Then we will palpate here, lightly palpate, noting that the appendix would be present here. In the right lower, up in the right upper, the border of the liver. In the left upper, the stomach and the spleen. And the left lower, the sigmoid colon. And we'd also be noting if there's any facial bruising or asking about pain on palpation there. Then we would move to percussing over the abdomen in the same fashion, where we would note normal tympany throughout, unless there was a dull sound where we would be on the liver of the border, for instance, or if there was any stool, if we were percussing over any stool. So that is there. While we have you laying down, I'm going to go ahead and move to your lower appendages here. Again, noting the skin temperature, which is warm to touch, excessive moisture, and the skin color, which is appropriate for ethnicity, palpating, and no lesions, and also at this point checking for edema by pushing against the tibia and the malleoli down in the ankle here, which none is noted. Then we will bilaterally palpate for the posterior tibial pulse and the dorsalis pedis pulse, which are both present bilaterally with a 2+ grade. And we move into the toes, looking for that capillary refill, which is less than 2 seconds. And clubbing also in the nails down there as well, none present. Then we'll do the Babinski reflex in the arch of your foot there, looking for a reaction. And that completes that. You can go ahead and stand up for me. Okay, I'm going to have you go ahead and just bend down for me. I'm going to assess your spine, which we're looking for any curvature or signs of scoliosis. So it is straight and normal, none of that noticed. Stand up. And go ahead and just walk to the corner for me, assessing the patient's gait, which is normal. And then we were going to do the Romberg test on you here. So I'm going to stand at your side. You can just close your eyes. I'll be here for balance. We stay here no longer than 30 seconds. And patient, you can open your eyes. Patient has good balance. And was there anything else that you wanted to note today or us to look into?
No.
Okay, that concludes our assessment then.